Hello, this is Giovanna Hamilton. This is my presentation for Nurse 6917 Differential Diagnosis with Miss Wright, and my presentation is on eye discharge. So, our patient is Brooke, a 21-year-old college student who has noticed yellow green eye discharge in both eyes this morning when she woke up for class. As a college student, Brooke wanted to save some money and get eyelash extensions done Friday on campus. Brooke has been to this girl before and has never had issues. She denies shortness of breath, chest pain, fever, or runny nose. Brooke's symptoms is itchiness in both eyes, excessive tearing that she thought was related to the eyelash glue, redness in both eyes, yellow greenish eye discharge, and burning sensation in her eyes. So when did these symptoms begin? Or when did this begin? She says she's noticed the eye crusting this morning before she woke up for class. Do you wear contacts? She says no. Do you only notice the eye discharge in the morning? She says, I just noticed the crusting and it's greenish yellow, but I am noticing it all the time. Have you been sick before? She denies not being sick recently. Do you have allergies to any lash glue or adhesives? And she says she does not have any allergies to lash glue or adhesives. I asked her to rate her pain or discomfort. She rated it a 6 out of 10. I told her to describe the discharge from her eye, and she states that it's yellow and a greenish color. I asked her, does she has any medical conditions? She just says she has asthma and anxiety. Was the lash tech equipment sterilized in a clean environment? She says she got her lashes done in a dorm room, and then that she noticed that the lash tech used the same supplies from a previous client on her. And then she denies having a runny nose or feeling stuffy or itchy. She just says she just has eye pain and then the eye goo. Her medical history includes allergies to cats and lemons. Brooke does have anxiety and asthma. She has a family history of anxiety, depression, and hypertension and diabetes. Currently on Zoloft and has an albuterol inhaler as needed. Brooke vapes and socially drinks on the weekend. And then she has a surgical history of an ACL repair and wisdom teeth removal. So her vital signs show that she has a temperature of 98.4 degrees, heart rate is 72, blood pressure is 118 over 76, SpO2 is 98% on room air. She's alert, friendly, and active. Her Perla exam was 3 plus. She has extraocular movement. Her fluorescent seeing exam showed no uptake except for slight mucal drainage to the inner canthus. Both eyes had mild injection. Crusting noted on the lower lids of both eyes. She was rubbing her eyes, and then she had the greenish yellow discharge. Her lung sounds were clear with no signs of respiratory distress. Heart rate rhythm was regular with no signs of murmurs. Her skin was warm and dry with no edema. Her skin is expected color for her ethnicity without lesions or rashes. She has no rashes or lesions anywhere on her head, face, or nose or neck. Her tympanic membrane is intact, pearly gray, with normal landmarks and light reflexes bilaterally. No signs of infection or fluid in the ear. Nasal mucosa pink and moist. Her septum is midline, and she has no nasal drainage. So the top 3 diagnoses that I picked for Brooke was the first one was bacterial conjunctivitis. Based on her symptoms, Brooke is experiencing the redness, an itching sensation that can be found with bacterial conjunctivitis. She does not have rhinitis, which is like a runny, stuffy nose. She does have the effects on both eyes. It's not involved in any of the eyelid. It's more at the bottom of her eye. Her discharge is yellow greenish in color. And then she also just has that painfulness with it and the burning. And then the next differential diagnosis for Brooke would be blepharitis. And blepharitis is more of a inflammation of the actual top of the eyelid. It's usually this red in color. It's itchy, but she would have some dandruff-like crusting on the top of the eyelid near the eyelashes, and she can also have a gritty and burning sensation with this as well. But she does not have that like dandruff-like crusting on the top of her eyelid, as well as her eyelid was not swollen, based on the physical head to toe exam. And then another conjunctivitis would be allergic conjunctivitis, which has similar symptoms to the bacterial conjunctivitis. However, Brooke also has the Brooke would need to have a runny nose with that. Um, and allergic conjunctivitis can also affect both eyes, which she does have redness in both eyes. However, her crusting would be more in a clearish color, and Brooke's discharge is a greenish yellow, which is leading more towards the diagnosis of the bacterial conjunctivitis. So the treatment plan for Brooke would be first getting an eye culture, and then this eye culture ended up testing positive for a bacterial culture was found. Her vision acuity test shows that she still has 20/20 vision. Her vision is fine. So we're going to continue with that diagnosis of bacterial conjunctivitis, which was caused by her going to the lash tech and probably coming contacting with someone who had a bacterial infection that has gotten to her eye. So the treatment plan for her would be just for kind of like symptom relief is applying a warm, cool compress, as well as prescribing Brooke with some Motrin 400 to 800 milligrams PO every 6 hours for pain, and for her to not exceed 3,200 milligrams per day, as well as providing her with Besivance 0.6%, which is a antibiotic drops, and she would put one drop in both eyes 3 times daily for a total of 7 days. The big important thing for Brooklyn to remember is to have proper hand washing techniques, avoiding touching her eyes, avoiding sharing towels or personal items with others, throwing away her old makeup or eyelash brushes, as well as making sure she's going to someone if she is going to get eyelash extensions, that they're in a clean and sterilized environment, and then that they are making sure that they're using clean and sterile instruments so this doesn't happen again. A big thing for Brooke to look out for is if she's having trouble seeing or blinking. If her eye discharge or redness is not gone by 3 days, she needs to come back in to have a follow up, or if the eye pain is getting worse. And these are my sources, and thank you for listening.